Hi, my name is Rachel Smith and I'm a provider here at Family Doctors Medical Center. I'm going to take a moment to discuss with you what to expect with part of our weight loss program. On your initial visit, we're going to do an EKG to scan you for any underlying heart conditions. We're also going to put you on the InBody scale, which you may have already done, and use this as a baseline to monitor your weight loss progress through the program. Every week, we're going to have you come in for a vitamin B12 injection and a weigh-in. We're also going to check your blood pressure and do your vitals at this visit. There is an additional shot too that is available to you called Lipo, which aids in fat burning. So if you're interested in that, mention it to your provider and they can set you up for that. Once a month, we're going to complete the InBody analysis scale to monitor any changes with your weight. So let's go ahead and go through a sample InBody together. So here you're going to see a sample InBody sheet. The InBody breaks down your weight into components of muscle, water, and fat. Directly below that, you'll see your BMI, which is your weight for your height. And below that, you'll see your percent body fat, which is what percent of your weight is actually fat. Below that, you'll see your muscle distribution. So it tells you the distribution of your muscle between your arms, trunk, or abdomen, and your legs. Directly below that, you'll see about how hydrated you are. So this is your extracellular water over your total body water. At the bottom here, we will be able to monitor your progress throughout the weight loss program. So as you can see, this patient was steadily dropping weight and his percent body fat is steadily going down. And for the most part, he was able to maintain his muscle mass. If we go to the right, up at the top sheet of the InBody, you'll see the maximum recommended fat loss for you. If you were going to lose any more weight than this, then you'd be borderline underweight. So we don't recommend for your goal weight to be any more than this. Directly below that, you'll see the distribution of fat between your arms, trunk, and legs. And directly below that, you'll see your basal metabolic rate. So your basal metabolic rate is how many calories you're burning by sitting around all day and doing nothing. Of course, with eating, exercising, working, you're going to be burning more than this. So the recommended calories for the day may change based on your basal metabolic rate. Directly below that is your visceral fat, which is basically just the fat that you have around your organs. Here, you'll see a sample 1,200 calorie a day diet plan. With the weight loss program, we recommend that you count your calories because the most effective diets are calorie counting diets. There are some apps that can help you easily track your calories. MyFitnessPal and Lose It are some popular great apps that you can download. For weight loss, we typically recommend 1,200 calories a day for women and 1,500 calories a day for men. Here on this sample diet plan, you will see the recommended servings for proteins, carbohydrates, fats, and vegetables, as well as which types of foods we recommend to stay off limits. The majority of your calories should come from protein and vegetables. We do recommend that you do 60 to 100 grams of protein per day. So in addition to counting your calories, please pay attention to how much protein you're consuming as well. So here is a sample food diary for 1,200 calories a day. If you don't want to use an app to count your calories, this would be a nice alternative for you. What's important with the food diary is that you make sure you note your portion size and how much or quantity of everything that you're eating. So if you're having a cup of rice or one slice of turkey, it's important for you to note these things so you can accurately count your calories. You list everything that you're eating throughout the day and you want it to total to 1,200 or 1,500, whether or not male or female. I really like this sheet here because it helps you estimate your portion sizes. Say you go out to dinner, you order a chicken meal, you're not sure how many ounces it is, but you need to estimate it to accurately count your calories. Here you can use these items to help you estimate the portion size. So say, for example, your chicken breast looks like about the size of 2 decks of cards. Since a deck of cards is 3 ounces, you can estimate that chicken to be 6 ounces. Also, if you have a slice of turkey, you can estimate that to be about 1 ounce since it's about the size of a CD. If you have some rice or potatoes and it's the size of a baseball or a golf ball, you can estimate whether it's a cup or quarter cup. With the weight loss program, we commonly use appetite suppressants to make it easier to follow a low calorie count diet. Your medical provider will discuss with you which medication or medications would be the best option for you. A commonly used appetite suppressant is a stimulant medication. So you may be prescribed a stimulant. If you do, the most common side effects with that are dry mouth. So it is important for you to increase your fluid intake. Other side effects with stimulant appetite suppressants could be difficulty sleeping, anxiety, or feeling a little bit on edge. When you start off with a lower dose the first month, this can prevent any of those side effects from happening. If you experience severe headaches, racing heart or palpitations, chest pain, shortness of breath, dizziness, or passing out, these are not normal side effects, and you should stop the medication and seek medical attention immediately. Those with a history of a heart disease, stroke, thyroid disease, you may not be eligible for a stimulant appetite suppressant, but there's many other options available to you that can be used as an alternative, and your medical provider will discuss this with you. Please be aware that this information may not apply to everyone's specific health care needs or chronic medical conditions. Therefore, please refer to your medical provider's recommendations, which will be catered to your specific healthcare needs and medical conditions. Also, be sure to disclose if you have any history of high blood pressure, heart disease, stroke, diabetes, thyroid disease, suspect or know that you are pregnant, or have plans to become pregnant in the near future. Some appetite suppressants can also decrease the effectiveness of birth control pills, so please notify your medical provider if you take one of these medications. Be sure to ask them any questions that you may have.